Hello, my name is Petra Heitkamp. I'm the community manager of the TB Learning Network community, the executive director of iLink2, recently founded, and co-chair of Stop TB Canada. I'm also proud to be part of the 2025 North America WomenLift Health Leadership Journey, Cohort B. And today I'm excited to share my leadership project titled Empowering Female Health Providers, Increasing Access and Saving the Lives of Women with TB. Tuberculosis remains the world's leading infectious disease killer, with over 10 million new infections each year and an estimated 2.5 million people going undiagnosed or unreported. While TB disproportionately affects men, women are frequently missed, often diagnosed late because health systems are largely gender blind. TB programs have historically focused on biomedical control, public health facilities, diagnostics, drugs, and largely male-led hierarchies. What's often missing are the social and gendered realities of access. Complex care pathways, stigma, lack of privacy, and limited preventive services. My project aims to shift TB care away from this narrow medicalized model toward a people-centered, socially inclusive approach. By empowering female health providers, particularly those working in communities and private sector settings, who are often the trusted first points of care. This is a busy slide, sorry about that. The theory of change is simple but powerful. If we equip, connect, and elevate female health providers, then TB services can become more accessible, trusted, and responsive, especially for women and families. By strengthening female health provider roles through evidence, networks, and policy influence, we can reduce stigma, improve early detection, and ultimately save lives while shifting TB systems toward care, dignity, and inclusion. This project is deeply collaborative. I'm supported by an advisory group with expertise in TB, gender, and policy, including WomenLift alumna Charity Oga Amenka. Critically, I'm collaborating across cohorts with Prachi Chukla in India and Obioma Chijioke Okaniro in Nigeria. Together, we ensure this work is grounded in local realities, equitable partnership, and shared leadership. So far, we've made solid progress. First, I completed a literature review and developed an assessment framework that places women at the center, examining barriers at the personal, household, community, facility, and system level, and identifying where interventions has the highest impact. Second, through collaboration with Prachi and Obioma, I've identified a strong list of key informants, female frontline providers and women in leadership positions in India and Nigeria for in-depth interviews. Third, following these interviews, we plan a webinar-based focus group on the TB Learning Network platform to share real stories, lived experiences, and practical solutions, amplifying women's voices across the TB ecosystem. The main challenge remains time and resource constraints, but the momentum and engagement are strong. So we all know that 2025 happened, and this has also impacted my journey and my project, which is not yet finished, but right in the middle. This project had been a powerful leadership journey for me. Authentic leadership shows up in my deep personal connection to this work. I've seen firsthand how gender-blind systems fail women. Inclusive leadership is central. Through interviews, co-creation, and cross-country collaboration, I'm learning to listen across differences, navigate power dynamics, and create space for voices often excluded from system design. Strategic leadership is being strengthened through managing complexity, translating vision into tangible outputs like research, operational guidance, and policy influence, while aligning with WHO's Stop TB and national TB programs. And impactful leadership for me means ensuring this work moves beyond dialogue into real change. In a time of global health funding cuts and system disruption, this journey has helped me reimagine my own role. I remain committed to global health, but with a renewed focus on people-centered systems. That commitment is reflected in the launch of iLink2, a women-led social enterprise consultancy, bridging strategy, care, and equity with colleagues based in Tanzania, Pakistan, and Canada. Thanks to all the women in the 2025 cohorts, colleagues, mentors, and coaches, thanks to the WomenLift management team, project reviewers, and everyone who has supported me in this last year's journey. Through WomenLift, I'm becoming not just a stronger leader, but a more courageous and catalytic one, and I want to thank everyone for their support.